I see some familiar faces. I might be a familiar face. If not, you'll know more about me shortly. We'll do an overview of what a stroke is, health is. We'll do a little bit of a Q&A, and then we'll wrap it up and get you all back out of here. So a little bit about me. So my name is Stephen. I'm an occupational therapist here with Good Shepherd. I am also a certified lymphedema therapist and a certified wound care clinician. So I'm originally from the East Coast. I am from Maryland originally, and I've kind of lived all over. So I have done a lot of work with neurological rehab, upper extremity rehab, psychological rehab, of course, wound care and lymphedema. So just a snapshot of what I have been involved with previously. All right, jumping right in. So what we're going to cover, what is the CVA, how it will impact brain health, family health, personal health, and community health, what treatment and recovery looks like for stroke, how rehab services can assist with recovery, where you can get recovery, and then what community resources are available here in the area. So the brain, a lovely little image here. We have technically 5 regions of the brain. All of them are responsible for different functions. So I'm not going to read all of these to you, but the strokes can impact any section of the brain. What I've been seeing more recently is cerebellar strokes, which can lead to what we call locked-in syndrome, which is where the mind is working, but the body does not. So those are quite devastating to the patient and the family. So did you know our brain is a complex organ that controls so many different things? It controls thought, emotion, sensation, temperature regulation, hunger, which is why we're feeding you today. So the brain and the spinal cord consist of the central nervous system. Everything outside of that is the peripheral nervous system. The brain is not a muscle. It does not contract. It does not do any lifting. It is composed of gray matter, white matter, and it's 60% fat. The rest of it is a hodgepodge of other stuff: water, proteins, carbohydrates, and salts. The brain may feel like a muscle because it does most of the work to control the rest of us. So we have 3 portions of the brain. We have the cerebrum, the cerebellum, and the brainstem. Again, the cerebrum has 4 parts. You have the frontal lobe, parietal lobe, temporal, and the occipital in the back. So again, each portion, as we saw at the earlier image, we do have specialized functions in the brain. So the deeper you get into the brain, the more high level and high complexity the functions are controlled. The brain is covered by 3 levels. We have the meninges. So meningitis is the inflammation of the meninges. So we have the dura mater. Always love that. It's called the tough mother. Who doesn't love that? The arachnoid, so the spider mother, and then the pia mater, which is all the way on the inside. So what is a CVA? Quick show of hands. Who knows what a CVA is? A few. Angie, I'm going to pick on you. What does a CVA stand for?
Cerebral vascular accident.
Correct. Commonly known as a stroke. So we have 2 types of strokes. There are ischemic strokes, which are the most common, and the hemorrhagic. So an ischemic stroke is when the blood flow is cut off to the brain. So this can be either short or long term. So we see a lot of, especially here at Good Shepherd, TIAs, or transient ischemic attacks. These can be quite frightening to the patient and the family, but those symptoms do typically resolve in a few minutes to a few hours. Outside of that, we're looking at more intensive treatment. And then, of course, hemorrhagic is a bursting of a blood vessel. That's also called a brain bleed. I didn't put this on here because it's not technically a stroke, but there is a type of migraine called a hemiplegic migraine. I actually am diagnosed with those, and it mimics a stroke because you will have complete paralysis of one hemisphere that will instantly onset and instantly resolve. So they were quite frightening when I had my first one because I ended up in a pile on the floor. And of course, I didn't go to the ER like a smart person. So please, if you do experience any symptoms, always seek medical treatment because it's just good to know. So how do you spot a stroke? And we're going to get into the warning signs shortly, but slurred speech, trouble speaking, or aphasia, that lack of word finding. Also, sudden numbness or weakness on one body part or one side of the body. So the stroke, if it starts in the left side of the brain, it will impact the right side of the body, and vice versa. Very seldom do you see a bilateral stroke. It is typically one-sided. So severe headache with no known cause, trouble seeing from one or both eyes, and then inability to walk, balance, dizziness. We have a lot of ataxia, which is motor discoordination. Has anybody experienced any of these symptoms before? Or does anyone have a family member? What were your symptoms? Oh, hello, sister and those. Aren't they awesome? Awesome. Have you been to a neurologist and the whole thing?
Yeah.
Okay. Yeah, what do you take for yours? Just so okay, that's Lady Gaga's medication, right? Okay. My neurologist said for me, don't take meds because the side effects for me would have been worse than the medication. But does it work for you? Perfect. So neurologists are wonderful. I will say, just as a plug for neurology, they are 6 to 8 months out. So getting in with them can be a challenge. I had to wait 6 months for an MRI and an appointment. So, but obviously, if you come to an emergency room, you will get faster treatment because that is an urgent medical need. So our FAST acronym, this is how we identify a stroke. So F stands for the face. Ask your friend or family member to smile. If they are lopsided or uneven or droopy, we might want to consider that having a stroke. Arms is A. Ask them to raise both arms. It doesn't matter to which way. If they cannot control one, we might be thinking about a stroke. Speech, give them a very simple phrase like the ball is red or the grass is green. If it comes out slurred, if they don't remember, if they can't repeat what you said, we might want to consider a stroke. If you have any of these on their own or a combination, we want to get help fast. So T is our last one, that is for time. Time is critical. So call 911 right away. If you are able to get them into an ER quickly, that would be awesome as well. So possible conditions after a stroke. So strokes, if they're ischemic, are caused by a blood clot somewhere in the system. So after a stroke, people are usually put on blood thinners or anticoagulants to help reduce the risk of clotting. But you can have these conditions long term. As always, we can have loss of function. So that is any muscle, so bowel, bladder, arms, legs. So loss of function, intense weakness, bone density loss, not as common. But the less people move, the less the bones are working, which means the less production they have of the minerals. So you may see bone loss, especially in the aging population. Memory and language deficits, pretty common. That's where therapy comes in. Obviously, I'm focusing on OT today, but physical therapy and speech therapy are critical in stroke rehab. Changes in sensation, touch, smell, hearing. So people often report that things don't taste the same, things don't smell the same. They may have distortions in hearing where they might have an echo. They may have visual deficits where they have a field cut where they can't see part of their vision, double vision, blurry vision. So we also refer people out to optometry just so they can have eyes checked and lenses created to help manage the vision. And then, of course, speech and swallowing difficulties. So OT, at least, and I will call on my two friends, Heather and Gina here. I stop therapy for me at the mouth. Once things get to the mouth, speech therapy takes over. How do you all feel about working with swallowing? Yes, no?
Some recommendations,
Okay.
some tips and tricks
And
I will provide for home.
not in this environment, but in previous environments, I was highly trained in modified hearing swallows and swallow studies along with the OT that I worked with and then the speech therapy. Here I don't do that, but I do have a lot of past history of dealing with speech and swallowing, mostly swallowing difficult.
And I've observed some modified barium swallows or MBS, and it's really cool to watch the internal mechanism. And I think Nicole was doing one today. So always good to have that checked. I refer a lot to speech, especially if there's something beyond the teeth that I'm not comfortable with.
Every 2 seconds, someone somewhere in the world experiences a stroke, and 1 out of every 6 people will have one at some point in their lives. Strokes deprive brain cells of oxygen and are one of the most common causes of death and the leading cause of preventable disability. When someone experiences a stroke, quick medical care is critical and can often help avoid permanent brain damage. But what causes strokes in the first place, and what can doctors do to treat them? The brain makes up just 2% of your body's mass, but consumes more than 20% of the oxygen in your blood. That oxygen is carried to the brain through a system of arteries. Carotid arteries supply, and vertebral arteries supply the back. These are connected to each other and divide into smaller and smaller vessels that get billions of neurons the oxygen they need. If the blood flow is interrupted, oxygen delivery stops and brain cells die. There are two ways this can happen. Hemorrhagic strokes are when a perforated vessel allows blood to leak out. But the more common type is the ischemic stroke, when a clot blocks a vessel and brings blood flow to a halt. Where do these clots come from? On rare occasions, a sudden change in heart rhythm prevents the upper chambers of the heart from contracting normally. This slows down blood flow, allowing platelets, clotting factors, and fibrin to stick together. The clot can be carried up towards the arteries and blood vessels supplying the brain, until it gets to one it can't squeeze through. This is called an embolism, and it cuts off the oxygen supply to all the cells downstream. The brain doesn't have pain receptors, so you can't feel the blockage itself. But oxygen deprivation slows brain function and can have sudden, noticeable effects. For example, if the affected area is responsible for speech, an individual's words may be slurred. If the stroke affects a part of the brain that controls muscle movement, it can cause weakness, often just on one side of the body. When this happens, the body will immediately try to compensate by diverting blood flow to the affected area, but this isn't a perfect solution. Eventually, the oxygen-deprived cells will start to die, leading to brain damage that may be severe or permanent. That's why it's important to get medical care as fast as possible. The first line of treatment is an intravenous medication called tissue plasminogen activator, which can break up the blood clot and allow blood to flow again in the compromised artery. If it's delivered within a few hours, this medication greatly increases the chance of surviving the stroke and avoiding permanent consequences. If tissue plasminogen activator cannot be given because the patient is on certain medications, has history of major bleeding, or the clot is particularly large, doctors can perform a procedure called an endovascular thrombectomy. Using a fluorescent dye that illuminates the blood vessels under a strong X-ray, the physician inserts a long, thin, flexible tube called a catheter into an artery in the leg and maneuvers it all the way to the blockage. A retriever is passed through this catheter. It expands and anchors into the clot when it's just past it. The catheter then pulls the clot out when it's removed. These treatments need to be delivered as soon as possible to preserve brain function, which means figuring out fast if someone is having a stroke. So how can you tell? Here are 3 quick things to try. 1. Ask the person to smile. A crooked mouth or facial drooping can indicate muscle weakness. 2. Ask them to raise their arms. If one drifts downward, that arm weakness is also a sign of a stroke. 3. Ask them to repeat a simple word or phrase. If their speech sounds slurred or strange, it could mean that the language area of their brain is oxygen deprived. This is sometimes called the FAST test, and the T stands for time. If you see any of those signs, call emergency services right away. Lives may depend on it. We're on a nonprofit mission to revolutionize education.
All right, we don't need to hear about TED Talks. So they covered treatment just a little bit. I will finish up after this. So again, medical pharmacological treatment, thrombectomies, which is the manual removal of a clot, and of course TPA. They said 4.5 hours, so typically 4 hours is that window. A lot of patients do hit the ED once they are past that. So the identification and the receiving of care has to be pretty prompt in order to get the TPA done. Good Shepherd, we are working towards becoming a certified stroke center. But if we have a lot of heavy duty strokes, they usually say goodbye and head somewhere else. So holistic methods, what does that mean? So that means non-drug treatment. So after someone has had a stroke, so the things listed here, such as acupuncture, chiropractic care, those are not to treat active strokes. Those are to be used after someone is in the recovery phase. So I did find some articles here that, because acupuncture, chiropractic, massage therapy are not first-line treatments. They are more holistic adjunctive treatments, but do pair well with your occupational, physical, and speech therapy. There is a lot of literature out there saying that high velocity adjustments of the cervical region can cause strokes. So always, if you are getting chiropractic care, talk to them about your concerns with neck adjustments. It's a pretty high percentage in the literature. I have not met anyone with a stroke that has had one from a chiropractor, but it can happen. So how can OT, occupational therapy, help myself or my loved one? So generalized rehab, so that's therapeutic exercise, range of motion, activities of daily living, so like getting dressed and showered, getting food to your mouth. We have adaptive equipment, built up utensils, which are the handles that are pretty thick. We have modified dishware with rims so people can scoop into the rim and get food to the mouth. And then home modification. So that's putting in grab bars, pulling up the area rugs, adding more lighting so people with the visual deficits can see more easily. Home health provides OT services, and that is great to get therapy in the home because we can assist with all of this. So I mentioned home health. Hospice does provide OT services. Those are for folks who have severe strokes and are at the end of life care. And then outpatient clinic. So when patients, typically they go hospital, skilled nursing facility if needed, home health, and then outpatient. So there is a trajectory of care to make sure patients regain their maximum function and independence. All right, we have flown through. We're going to wrap it up here. What I didn't cover is community resources. So we have connections that can help with finding things like DME. There's Clearview in Pendleton that does DME rentals, 90 days for free. At the end of that time, you can return it or purchase it, I believe, at a reduced cost. And then, of course, we do have home health here through the hospital. One other great service is our community paramedic service, which is a free service. Jess is great. She does a lot of good work out and about. So she does check in on people and she kind of follows them as much as she can. So again, brain, if the brain doesn't work, we don't work. Brain kind of leads the show. A change in brain chemistry can occur across the lifespan. That's just due to natural aging. Some of these changes, which can have negative side effects and outcomes, and it's not just chemical, the brain itself can shrink in size. So we call that atrophy of the brain matter. So traditional medicine plus holistic options are available. They work well together for optimal recovery. Again, OT, we combine the medical knowledge with the holistic knowledge to treat the person as a whole, and that also includes their environment and their family. So lastly, Good Shepherd, of course, does provide many rehabilitative services, both inpatient, outpatient, and across the community. Whew. Rocket fire. Does anybody have any questions for either myself or my other two OT counterparts here? You're welcome for bringing that in. Any questions on strokes or prevention of strokes? Didn't really talk about prevention. So things like modifying diets. So things that are more holistic or healthy. Mediterranean diet is great with healthy fats, lower carbs. Smoking is a big one. The less someone smokes, the less vessel damage they will have. So the less risk of blood clot and loss of blood flow. What am I missing? Exercise. Gotta be up and gotta be healthy. I can do better about that myself. So with exercise, we want to have a combination of resistive and cardiovascular exercise.